I'm going to invite Dr. Vase. He's a senior neurologist from Aga Khan University, Karachi. Very honored that he's come all the way from Karachi for us. And it's just that before we have to break for Jummah prayers, we would like that the three societies, all of them are sitting here, so we get a chance to hear from all of them together what we can do.
Assalamu alaikum, Bismillahir Rahmanir Rahim. So could you put the slides on? Now, first of all, I would like to thank Dr. Asim and Dr. Bashir Hanif for inviting me. It has been a great learning session for me. I learned a lot of things about what's going on related to stroke care in Pakistan. In next 10 minutes, we'll just go through related to what's going on with stroke in Pakistan, especially in the last couple of years. Next slide, please. So there are no disclaimers related to this presentation. Next slide, please. Now, go back. Okay. Chal rahe? Acha. So now, before we move on to the micro environment, just I wanted to take you back to the macro environment. We live in a country which has a 225 million population, which is going to be 25 crore maybe as soon as this census is over. We have a literacy rate of about 50%, or GDP hamara is number 181 in the world. So we are living in a country with this status. This is our life expectancy, 67%. We only spend 1% of our GDP on health, and 70% of healthcare is out of pocket. So people pay from their pocket. And we have a very high burden of cardiovascular risk factors. So hypertension, 34% population is hypertensive, more than 10 million diabetic. We have 23% adult population who smokes or uses any kind of tobacco. Our air pollution index, which is a very important risk factor for cardiovascular disease, is 130 to 250 in large cities. So this is the current status of healthcare in Pakistan. Now, when we look at the stroke burden, I think this is important because we should know that what is the denominator, what is the actual volume of stroke. So we have about 250 per 100,000 new stroke every year, which is 350,000. So it's 1,000 stroke every single day. 1,000 stroke every single day. Population-based prevalence is 1.2%. About 25% is intracerebral hemorrhage. Out of ischemic stroke, 30% is large vessels. So mostly we are talking about LVO, which is thrombectomy, 30%. So about 100,000 patients in 1 year, or 300 patients every day with large vessel occlusion, which the standard of care is a thrombectomy. 30% is small vessel disease, 10% cardioembolic. And we have a very high risk factor among stroke population. So mostly 70% is hypertension. And this is, I think, one intervention. You're all cardiologists. There's one thing I want, that if we can control the blood pressure in this country somehow, we could reduce the burden of stroke about 15 to 20% or even more. So this is, I think, the most important intervention for all the cardiologists in the country. If we are the GPs, that we should be able to control blood pressure in this country. Now, our stroke population is younger as compared to other parts of the world. Our mean stroke age is about 55 years as compared to other countries where it's about 65 years. Our young stroke, which is less than 40, is 20%. We have a higher burden of stroke in women. So 60% of our stroke is in women. And stroke mortality is very high. I think this is one important aspect. Our stroke mortality is 40%. इसका मतलब क्या हुआ कि रोजाना पाकिस्तान में 1000 लोगों को फालिज हो रहा है, और रोजाना 400 लोग फालिज से मर रहे हैं. 400 लोग रोजाना फालिज से मर जाते हैं. इतने कभी ना कोविड से मरे, ना किसी धमाके से मरे, लेकिन somehow people even don't even know कि इतनी बड़ी तादाद में लोग मर जाते हैं. 30-day mortality related to stroke is about 16%. Now, World Stroke Organization कहती है कि हर जगह पे एक मिनिमल हेल्थ केयर सर्विस होनी चाहिए, स्ट्रोक सर्विस होनी चाहिए, एडवांस. हमारे यहाँ एडवांस स्ट्रोक सर्विस तो is available to less than 1% of population. Now we come to what is stroke service provided by neurology. Now there are only 290 neurologists in the country. So it's like one neurologist maybe for 0.9 million population, and very few stroke experts. There are only 14 stroke units in Pakistan. 10 of them are in private hospitals, 4 in the government and public hospitals, where most of the stroke goes to actually public hospital. Now we have a lot of CT and MRI facilities because it's all private mostly, 80%. And for 70% people in Pakistan, they have access to CT MRI within 3 hours. So this is a good thing. We have a lot of rehabilitation doctors now, more than 3,000 DPTs, mostly trained by the private physiotherapy medical colleges. And so they are able to provide good physiotherapy services. Now thrombolysis is available in 30 centers in Pakistan now, mostly using 0.6 milligram per kilogram because of the cost. But other centers are using 0.9. We don't have a tenecteplase available, which is, I think, a very good, if it's available in Pakistan, it could be very good, especially in the rural centers. Then you don't have to infuse. You can just give one shot. TPA started in Pakistan in 2022, so we are just in the early phases. In 2022, we only utilized about 200 vials of TPA, but hopefully in 2023, 1,000 vials we utilized in the 30 to more than 40 centers. And these are all the hospitals where TPA is available in Pakistan, which is kind of all the major cities in the country. Now thrombectomy, to my knowledge, there are about 10 centers in the country, and we have done about 200 thrombectomies in 2022. The unfortunate thing is that if you just look at the literature, there is no published data related to thrombectomy in Pakistan. And this is, I think, one, if we are talking about way forward, one way forward I want at least that whatever data is presented here, from IRIC, NICVD, TABA, we should publish this data. But this is the single most important way forward, and we should share our data. We should have a multi-center registry, multi-center data. We have interventional neurologists, interventional radiologists, interventional cardiologists. They even don't know each other, and there is no collaboration. For example, this is a list of the thrombectomy centers in Pakistan, and there is no communication among them, even not a learning communication. So this is, I think, one other way forward that we should be able to communicate, and I'm really thankful to Asim to bring all of us together. I think this is a very good step forward, that we should work in collaboration. Stroke is a multidisciplinary care. It's like 1,000 stroke every day. Who can take care of a stroke if you are not working together? So stroke services, stroke society is planning to establish 40 stroke centers in Pakistan by 2023. We are doing a lot of training for general doctors for stroke prevention and acute stroke care. So we have trained more than 2,000 doctors. We are doing training for nurses and training for emergency EMS, the ambulance service, doctors for post-stroke care. We have two stroke training programs, 1-year fellowship program. And we also have one stroke interventional neurology training program for stroke with Dr. Umair at LGA. So we have trained 3 neurologists as interventional neurologists, and they were trained for thrombectomy in 2022. So that was something which was done in first time in Pakistan. So we have a very active stroke society, which I think could collaborate with your society very actively. We do a lot of CME. We have stroke guidelines in Pakistan, and we have a module for nurses training. Stroke Society is doing a lot of research work, and I think this is something which we could learn from each other. For example, we have a mobile app-based stroke registry. More than 2,000 patients enrolled. We are doing a lot of interventional trials, like large intervention trials, which are global intervention trials. We have a research stroke trials network, so we could do intervention like randomized control registries and trials. So we have done a lot of research related to mobile health and stroke care at randomized control side. This is something. So what we can do together is a public awareness, which is very low, so we could join hands doing public awareness. We can do doctors awareness. We do a lot of World Stroke Day activities, a lot of media activities, public awareness campaign, government awareness campaign. And I think one important aspect of our program should be to get the burden of tobacco down in this country, because gutka and tobacco is 23% adult population, which is very, very high. And we have to get this down, and we have to also work on air pollution, which is also very important. So these are some of the challenges which I kind of highlighted, that we have a high burden, poor awareness, smoking, tobacco, NCD is a very low priority. GP's training for stroke care is suboptimal. We have a very high after mortality discharge. If you look at the hospital discharge data, 13% mortality at discharge. People go home in a stable condition, but 40% they die within 1 year. So there is a lot of post-care hospital post-discharge care which has to be improved, and there are no patient support groups in Pakistan, at least at this point, to improve. There are opportunities. We have a lot of mobile app users, so we could use that. We have a lot of entrepreneurship, which we could use combined. Health awareness has kind of become a priority after the COVID. Now, WHO and Sustainable Development Goals has a lot of emphasis on non-communicable diseases and disability. And I think healthcare financing is increasing in country, and Pakistan society is, stroke society is willing for collaborations. So we have to work on this comprehensive stroke care in Pakistan, collaboration with the neurologist, interventional neurologist, radiologist, cardiologist. We need to start data sharing, multi-center registries, especially registries for thrombolysis and thrombectomies. I think we should get tenective plays in the country. I think that could be very helpful. And we should start joint trainings and rotations. And we should go for WSO certification. WSO certifies stroke centers in the country. We have no stroke center in the country which is certified with WSO. So in conclusion, we have a very high burden, low resources. We now have a critical mass. If we combine neurologists, cardiologists, interventional neuroradiologists, I think we could provide a good service to our stroke patient population. And we have to jointly work on awareness, training, research, and advocacy. And I think we need a long-term strategic plan. Like other than just meeting in the meetings, we should have a 5-year or 10-year plan that how could we improve stroke care in country. Thank you very much. I again appreciate for you to be here on this very late afternoon on Friday. Thank you very much.
Thank you very much, Dr. Vase. I think it was quite an informative and interesting presentation.